right, in this video, I'm going to talk about what you need to do when you have an ankle sprain. This is a very common injury, and because it's so common, people often don't take it seriously enough, and then they're surprised at how much it's affecting them. So the first thing I want to do is tell you about the different grades of an ankle sprain, and there's three main grades, the first one being a grade 1. A grade 1 ankle sprain is usually just a mild stretch of the ligaments and some of the tendons around the ankle. And typically, this may cause mild swelling, maybe a little bit of soreness. It probably won't affect your gait very much at all, like you'll still be walking normally. And within a couple days, you'll be feeling better. That's just a really easy one, right? Grade 2 is a little bit more stretching and even possible mild tearing of some of the ligaments around the ankle. This one usually involves more swelling, a lot more pain. This is probably the most common ankle sprain that people get. With a grade 2, a lot of times people will need to be immobilized in some sort of brace or even a boot for 1 to 2 weeks. And this ankle sprain will get better, but it definitely takes a little bit longer. If you're not in a brace or boot, you'll probably limp due to the amount of pain that you have. The third one is a grade 3. A grade 3 is usually a partial or complete rupture of some of the ligaments that go around the ankle. This one doesn't always have a ton of swelling, but sometimes does. You do have a significant amount of pain with it, and then you will almost always need to be in a boot for at least about 4 weeks, sometimes a little bit shorter, but we now know when we want an ankle to heal, we want it to heal tighter, not looser, and so being in a boot is a good idea. Now, the other question that arises when people have an ankle sprain is, how do I know if it's broken or not? Because you can, in the midst of getting an ankle sprain or a bad ankle sprain, actually fracture the bone, right? And so a couple of the common places where you can actually have a fracture with an ankle sprain, and the most common is this way of what we call an eversion ankle sprain, is on the outside here of this is your lateral malleolus, the tip of your fibula, where the bone, where the ligament attaches to the bone there, that can actually pull off and cause a little bit of a fracture. Also down along the edge of your foot, an area along your fifth metatarsal, that can also fracture just from the pressure of going over onto that bone. So one way that you can look to see, well, do I possibly have a fracture, is if you feel there's a spot along the bone that's very specific where it hurts a lot, right? So you would maybe run your finger along the bone, and if you feel it right in just one spot about the size of a fingertip, that's a good indication that there's possibly a fracture. But let's say there isn't anything specific and it just hurts, the general area just hurts, then maybe not. But of course, you can't always tell, right? That's why we have x-rays. So sometimes if you're wondering and you're not sure, then definitely get an x-ray. Now, concerning x-rays with ankle sprains, what I found in my experience is that a lot of times smaller fractures or stress fractures don't show up right away. So people will sprain their ankle, rush off to get an x-ray. It shows no fracture, and usually it doesn't show a fracture because there's some swelling in the area and it's not a clear enough image, or they don't go to an orthopedic, they just go to urgent care. And so they think, well, it's fine, I don't have a fracture, I should just be able to do what I want. But then it keeps hurting, and then they find out later that they have a fracture. So sometimes it pays to wait several days, maybe up to a week before you get an x-ray to determine if it is fractured. So those are the grades of the ankle sprain. There's a little information about a fracture. Another thing with fracture that you also will feel sometimes is vibration will bother it, right? So let's say you sprain your ankle, you're in your car and you go over a bump, your ankle doesn't move, but you feel it in your ankle, that vibration, that's also sometimes indicative of a fracture. So grades of the ankle sprain, some information about fracture. Next, what we'll talk about is what should you do in that first 48 hours to help speed along, hopefully, some of the recovery from getting an ankle sprain.